Hello. The leadership skills questionnaire found me to be very high in interpersonal and conceptual, high in administrative skill. I believe it takes all three to be an effective leader. Managing people is very important. The manager must connect with employees and understand their jobs. Also, having effective communication skills will foster the relationship between the manager and the employees. The staff must feel confident that the manager is a good listener and shares knowledge of the organization's concerns and awards. The manager must have the ability to work with subordinates, peers, and superiors to reach the goals of the unit organization. Having a working relationship with staff aids in making changes flow smoother. A manager must maintain their emotions to project a professional environment which will lead the staff to share concerns and accomplishments in the work area. Last but not least, the manager needs to solve problems with strategic planning and creative vision. A manager must have trust and respect for and from employees to provide support and guidance. Having excellent communication skills with the employees allows the staff to share negative and positive aspects of the job. This in turn aids the manager with problem solving, strategic planning, and creative vision. The model management engineering method would be my choice to secure needed resources such as staff. The management engineering method examines staff and unit needs. This approach is developed from information obtained from nursing staff, type and volume of patients, bed capacity, and operating budget. Each unit requires different support. I have worked different specialty areas in my nursing career. Each area required a different type of staffing, knowledge, and skills. For instance, working in the NICU, we had 1 to 2 neonates, depending on their status. And working postpartum and GYN, I could sometimes have 10 patients, depending on their status. The staffing requirement is different for each unit. The operating room requires 1 nurse per patient. Working in the operating room as a circulating nurse would be classified as a service provider with leadership responsibilities. The next level of management for me in the operating room would be the patient care team coordinator, who must still have all 3 leadership skills: administrative, interpersonal, and conceptual. The patient care team coordinator must work with multiple departments to ensure the operation of the operating room, to ensure that it runs smoothly for the safety of the patient. The operating room must work with surgical techs, circulating nurse, pre-op nurse, post-op nurses, lab, pathology, radiology, anesthesia, and the surgeon to provide excellent quality care. The different personnel require different levels of education and skills. Interdisciplinary approach is necessary for the operation of the surgical environment. The team must work together with their different skills and knowledge. A transdisciplinary approach would not be feasible in this case. For a surgical tech cannot perform the skills of the nurse, and the nurse cannot perform the skills of the surgeon. It is important that all team members work together and share their knowledge, but skills cannot be shared from one to another. This would be working out of their scope of practice, which could result in losing their job and license. A transdisciplinary approach requires the team to work interchangeably within their group. This group of professionals can function interchangeably with each other's responsibilities. This proves that the operating room team cannot function interchangeably with each other's responsibilities. The transdisciplinary team can share responsibilities because they feel comfortable sharing their knowledge, skills, and roles with each other. This type of approach would work with pre-op nurses and intra-op nurses and post-op nurses. The nurses could work interchangeably with the care of the patient. This would foster a team atmosphere. The organization I work for has a vertical structure. We have a board, we have a CEO, directors, managers, coordinators, and charge nurses. This type of structure has advantages and disadvantages. Vertical structure requires a strong leader at the top, which are better at designating jobs to departments and employees and have well-defined responsibilities for employees. Disadvantages is a weak leader creates an unstable organization which can lead to poor decision, and then the employees will be unhappy. Unhappy employees are distracted, and this can interfere with patient care. My preference would be a matrix structure, which consists of both vertical and horizontal. The matrix structure helps to create teams within the organization that belong to different departments but share similar goals that affect the organization as a whole. In return, the team can bring different ideas to the table to work towards the resolution. Teamwork is important for a department to be successful with delivering high-quality care to the patient. The manager is part of the team and must have specialized knowledge, skills, and the desire to improve the health status of the public while ensuring safe, effective, quality care. Leadership skills are learned. I contribute the foundation of my leadership skills to my mother, who I observed managing the family, the finances, and the material supplies to ensure a safe, effective, quality care for me. Thank you.